Rachel.
And we're the directors of Jing, Advanced Massage and Training, and we're going to talk about treating people with fibromyalgia. So this is a chronic condition that affects one's immune system, and we get a lot of questions about it and how you can treat it and why you could treat it and what's the effects. Rachel, tell us.
So first of all, massage therapists get a lot of fibromyalgia clients because it is a complicated condition. So often people have been all around the houses trying to get relief from Orthodox Medical Service and then other therapists, and they usually pitch up at your door kind of like 10 years later in a lot of chronic pain. I think the thing that I really want to say about fibromyalgia is that it's definitely a combination of psychological factors, social factors. There's generally a lot of things going on. Note that I'm not saying the pain is in the person's head, because it's not, but what happens in fibromyalgia is that there is a lot of general diffuse pain. So you get the symptoms tend to be things like you can have cognitive problems like not being able to think clearly. Fibrofog is a term. Chronic pain that moves all over the body. It can be in a shoulder one week, in the hip the next, or in both at the same time. You can have digestive disturbances, IBS, often very common, trouble sleeping, insomnia.
And then also like the real kind of classic thing, which is literally the inflammation of a joint. So the inflammation within the hands or the wrist, which often kind of go alongside the idea of rheumatoid arthritis, which is sort of similar line of conditions that people might have been diagnosed with first before they got the diagnosis of fibromyalgia. So often, this is the idea of tiredness, like lots of, loss of energy throughout the day. And again, when you're doing your consultation, you want to say to somebody, right, don't make any assumptions. Tell me about how this fibromyalgia is affecting you and how you would like to feel different. And then try to lock them down into specific things. So it's like, I just want to have more energy. Okay, fine. So when do you feel like you have the lowest amount of energy? When do you feel like you have a little bit more of a burst? Is it morning? Is it evening? Is there a particular activity that you want to be able to do that you feel like this is preventing you from doing? And allow that to be your benchmark throughout your treatment.
The hands-on portion, heat, definitely really helpful, and there's research
surprisingly
research to back that up. And fascial work, I would say, is one of the key components of my treatment. Fascial work, trigger point work, you can use, but definitely use it sparingly on the first treatment, because with some people that can be too much. So often people's systems are very, very sensitive. So start more gently, and then you can see if you can build it up. Stonework actually is brilliant as well. And
check in with your clients, as always, after the first treatment, after 3 days after the treatment. Commit yourself to treating somebody with a chronic condition, and if you make that relationship, you can adjust your treatment as you go along. And as Rachel said in the beginning, you're probably kind of the last resort. So if you offer somebody a listening ear and a listening touch, you can really make a difference in their quality of life.
There was something else really important I was going to say, which was what important thing could I be going to say?
Treat people and experience it for who they are, where they are at the time.